Hello, everybody. This is Ahmed Elghzali. I am a second year medical student here at Oklahoma State University Center for Health Sciences. Today, I'm going to present a poster presentation here regarding a cross-sectional analysis of data sharing practices and high-impact rehabilitation journals. Globally, it is estimated that 1.3 billion people experience significant disabilities, and 1 in 3 people will require rehabilitation at some point in their lives. And these numbers are only expected to grow in an aging population. And so, high quality, transparent, reproducible research is critical for meeting these challenges. So, a data sharing statement is a statement that tells the reader if data associated with a certain paper is available and how to access that data. And so, data sharing statements aim to enhance reproducibility and validity of studies, reduce research waste, and enable researchers to build upon each other's work. Now, unfortunately, significant gaps persist in data sharing practices, particularly in rehabilitation. For example, uh, there are gaps in articles where not data sharing statements are not always found within the articles, and even when authors claim to uh, say that they will share data, it is not always shared. So this leads us to talk about our objectives of the study. We aim to assess the prevalence, quality, and implementation of data sharing statements in top rehabilitation journals. We wanted to identify barriers uh, for standardizing data sharing statement practices, and we wanted to guide policies to enhance transparency and reproducibility in rehabilitation research. So this study was a systematic review and cross-sectional analysis. We went to PubMed and we targeted the top 5 rehabilitation journals by impact factor. And then we included original rehabilitation journals, and we excluded any editorials, reviews, commentaries, and single case reports. And data was collected in a blinded and duplicate manner with two extractors, and then and the data was then reconciled. Um, and so our studio was used for a statistical analysis, and we used a participant to disease representation ratio score and standard error for analysis. And a theme analysis of the extracted data sharing statements was conducted to quantify the variety of data sharing statements that were reported. And then following the preliminary part of the study, we wanted to verify those authors who did indicate that they will share data, and thus an email was sent to assess compliance of these statements, claiming for the authors claiming that they will provide data upon request. And so our study had some interesting findings. We found that there was an overall increase in the ratio of articles including data sharing statements from 2017 to 2023. And also articles which were open access were more likely to report data sharing statements than articles that were not open access. In terms of our data sharing themes, the most prevalent theme was the gatekeeper rule, which appeared in about 79.3% of the data sharing statements. The gatekeeper rule essentially is that data is available upon request to a corresponding author. Conditional data availability was found in 60.83% of these statements, essentially saying that there are specific parameters that the one requesting has to meet in order to obtain said data. And uh, when we did end up emailing the authors who indicated that they were willing to share data, we sent 251 emails, and we received 89 responses, or 35.46%. And of those 89 respondents, 43 or 48.31% were willing to share de-identified data unconditionally. 16 or 17.98% were willing to share it only under specific conditions, and 11 or 12.36% of the authors refused to share their data, citing reasons such as ongoing analysis, concerns about privacy, or data ownership issues. And so we saw some interesting data sharing statement trends over the years from 2017 to 2023. Uh, and on the left side, we can look at trends in clinical trials, cohort studies, and cross-sectional studies. And on the right side, we are looking at trends comparing between different journals. And looking at these figures here, we can see, for example, the Journal of Neuroengineering and Rehabilitation had an almost near inclusion of data sharing statements, and other journals such as the Physical Therapy Journal saw a pretty notable increase in the last couple of years. And so we can look at these differences in data sharing statement uh, trends over the years. Uh, So our hierarchical logistic regression analysis with the random effects summary showed that the baseline log odds of including data sharing statements were significantly low, with an intercept estimate of negative 10.227, which was statistically significant. This finding suggests that when all other variables are held constant, the likelihood of rehabilitation manuscripts, including a data sharing statement, is considerably low. Furthermore, the impact factor had a strong and statistically significant positive effect on the inclusion of data sharing statements, indicating that journals with a higher impact factor are more likely to include a data sharing statement. However, findings could be confounded by a single journal with a very strong data sharing policy. So, in conclusion, rehabilitation journals show inconsistencies in data sharing statement inclusion and adherence. Journal requirements and guidelines for data sharing statement policies likely impact the variation of data sharing statement inclusions between journals. Journals with mandatory data sharing policies generally had higher rates of data sharing statements, demonstrating the potential effectiveness of stringent policies. The troubling gap between stated commitments to share data and actual compliance in data sharing within rehabilitation research is concerning. Using an open science repository could alleviate the burden on authors by handling data storage and export. Further standardization of data sharing statements is needed as alternative methods like data repositories have been shown to improve transparency and reproducibility. And here are references, and thank you.